What is going on, gang? It's your boy Taco. Today we're watching the Pitt episode 1. But before we start the video, I just want to let y'all know that episodes 1 through I think 8 are probably available on Patreon right now. I've made episodes 1 and 2 free for early access for y'all if you would like to go there and view them if you did enjoy this video. But like I said, I don't want to be too long-winded. The thing is, I'm in a weird spot with YouTube where my videos aren't getting promoted too well. So if you only see one video and you're wondering where the rest of these reactions are, I'm continuing the series on Patreon. I've loved it so far, and I'm gonna finish it there. But there's no guarantee that I'll keep putting them on YouTube just because my numbers haven't been really reflecting that people are engaging with my stuff right now. But if you would like to watch that stuff, like I said, episode 1 and 2 are free on Patreon, and we're all the way up to episode like 7 right now. I appreciate y'all. I love y'all. I'll chill and let y'all get to the video. I hope you enjoy it. I want to show y'all this first. Okay, you can read it. Can you see it? Maybe not. You can zoom in on that. This is my EMT certification. Okay, so I may know what I'm talking about, but also I'm so out of practice. I haven't practiced or haven't trained in 3 years, so I haven't been doing that. So what is going on, gang? It's your boy Taco. We're back with another reaction today. Today we're watching the Pitt. I do have 6-7 years of EMT experience, behavioral health technician experience as well too. But you know, I kind of want to approach this in a different way. I really just want to, you know, I'm sure there'll be moments where I just can't help myself talking about certain things or aspects or how one-to-one this is with my personal experience or experiences that somebody else may have had. But I want to avoid making the Pitt feel like homework for myself. I know it's weird because I'm sure y'all want that, but I'm just telling you, I'm so out of practice. There's gonna be things that I'm not gonna really be knowing too much. I'm pretty sure, especially if it's gonna go super deep. I seen you know, there's a couple of doctors' reactions out there, some other EMTs that are reacting to this as well too. So I mean, check them out as well too if you haven't already. I'm sure they're probably knocking it out of the park, going super in depth about things like that. But y'all know me, I kind of want to approach it more in just the acting aspect and the moving pieces and stuff like that. That's what I want to see. Shout out to my Patrons. I appreciate y'all. I love y'all. I think what I saw about this show is, I believe, yeah, it seems like it's set up to be a complete shift, like a complete day shift of being on a team. I'm excited to watch it. This was our poll winner. By far, it smashed everything. So hopefully we're gonna get into some really good stuff here. I don't know what to expect besides probably chaos. But let's do it. Let's do it. Keep it short and sweet, guys. I hope y'all been well. The Pitt. Chicago? He's the doctor on call? Or not on call. He's actually in. Getting ready for shift. Oh, you're having a busy night tonight, brother. Hour 1. Yep. Oh, Lord. Baby's crying. How many people here are here? You know, like, obviously he's a doctor, so he's got to be thinking already. All right, we're having a busy night. Turnover is going to be pretty long. How many of these people are going to be here for serious issues? How many of these can be handled by other personnel? Of course, of course, of course, of course, of course, of course. That's funny.
Gloria is looking for you.
No guts, no Gloria.
I won't, but thanks. Where's Abbott?
Getting some air.
Oh, no, okay. Is she pregnant?
You okay in there? I like to say it goes away, but I had morning sickness for 6 months with my second daughter. Oh, who am I kidding? You tell anybody yet?
Not until I passed 12 weeks, not this time.
But just so you know, Robbie's working today. Today's the day Doc Adamson died. He hasn't worked it in 4 years.
So why is he here?
All I know is he still blames himself for Adamson's death, so if he's a little prickly today, give him a pass, okay?
Great.
Thank you.
Morning, Jack.
What are you doing here?
I'm working.
Coming off shift.
Oh, I don't know. Had a guy come in, hit by a drunk driver in a crosswalk, survived 3 tours without a scratch. I spent the last 2 hours coding him.
Shit.
It's always a rough way to end the night. Because this is the job that keeps on giving. Nightmares, ulcers. You jump on my shift. That's just rude, man.
Doctor humor, medical humor. It can sound up.
A small bowel obstruction waiting on a note for the family of my dead vet if anyone shows.
Shit. So I guess they did their turnover in the elevator.
Intern starting today, so.
Oh, he has people shadowing. That's the guy on Zyprexa, right?
Sir?
You see crazier things.
Who left this mess?
They had a rough night.
Good morning, sunshine.
Dr. Rabinovich, I will be joining you today. I just came from 2 months in the VA. Nice to meet you. I can't tell you how excited I am to be here today. So.
Talk to me at the end of the day.
Busy day, coming off shift. He's coming on shift. You have somebody shadowing you, and it's like, of course, when people are shadowing, they're coming in with high energy, and sometimes it is a bit like, oh shit, like I need to really. Not only do you need to be on your game, but it adds an extra element to it because you're also like speaking everything out with somebody else. Sometimes you get into a habit, even as an EMT, you're just doing your thing. You're in your flow. You're in your routine. And to have to speak it out to somebody else and make sure you're relaying something for them to pick up while you're taking care of people is a lot to juggle. And they got a busy day already going on. So shit. I mean, yeah, even just that, like, yes, you need to make sure your patient is comfortable with having student patients around as well too. You can't just walk in, like little small things like that. You can't just walk in there with 4 or 5 people because that's like really a little bit too abrupt for a patient. Especially you got a female patient here, you got males and stuff with you. You want to make sure that you're always making sure your patient is comfortable.
Burn my hand on a sterno.
What are you doing with the sterno?
Cooking.
You-
We're making s'mores. I have to get them to school. Do you know how much longer this will take?
1,000 of Tylenol, 400 ibuprofen, and saline dressing.
Please.
Okay.
All right, Sherry. We're gonna patch you up and get you out of here as soon as possible, okay?
Pain meds and the dressing.
Hold out your hands for me, Louis.
Yeah.
Two of the resume.
On it. And a script for Librium.
It's good to see you, Louis.
Bar fight with complete avulsion of tooth number 8. Smile.
Oh, he needs dental.
Oh, where's your tooth, Charlie? Aspiration.
Incoming.
42-year-old male Sam Wallace, blunt head with agonal respiration.
Took a spill helping a woman who fell off the track.
Woman fall from T platform. Good vitals, no head injuries.
I mean, that was a good turnover. It was quick and efficient. He learned all the things that he needed to learn about that patient and where to put him. Because this one seems like it's coming in with a little more heat. But you got to be aware, like, the screaming and stuff, you got to kind of ignore that and just hear the turnover and where exactly. I didn't get to hear because they have her really screaming loud over here. But no head trauma is what they said.
Fracture dislocation of the ankle.
Yeah. That's got to fucking hurt. But at least her head is okay.
How we doing? Ready?
Degloving. Pulled all that skin off.
3.
Good breath sounds bilaterally, but we need to protect it.
Checked his lung, good breath sounds bilaterally. They just did their, they moved him over. I mean, shit.
Doing ready?
They're flying, of course. He has a head. Oh, man, I think I'm going to be here for a long time. Like I said, obviously there's a bunch of doctors and shit already watching this. But if you have a head injury, right, the thing they're going to be checking with his eyes, I forget exactly, is they're still round reactive and stuff, something like that. They want to make sure his pupils are still fucking like contracting and stuff like that, and making sure they're equal, like equally restricting and retracting. Forget the verbiage. Like I said, it's been 3 years. Retracting whenever they like put a light into his eyes, because you want to rule out the fact that he might have a head injury. You're also going to be like checking his ears to see if he has like CFS. CSF. What was CSF though? Cerebral spinal fluid. Like it'll be some clear liquid like leaking out of your ears and shit like that if you really banged yourself up pretty bad. And then obviously they already have something in his airway, so they're keeping his airway open, making sure he's breathing and stuff like that. But I mean, man, like there's a lot going on. There's a lot.
Pupils 4 millimeters and reactive.
Okay, that's encouraging.
What do you
Like that's encouraging. That's good.
about a monitor? Force a DOAC. Standby before factor PCC if there's a brain bleed.
Clotting factors 2, 7, 9, and 10.
50 of Fed, didn't touch her.
Did she faint or did she trip?
The guy jumped down, pulled her off the tracks just as the train was rolling in. Isolated injury to the foot. Got caught between the platform and the incoming train.
Ma'am, what's your name? Airway and breathing are perfect.
ABCs, doing airway, breathing, and circulation. Those are the main things you want to make sure are good. That means she's alive. She's still going. She's not about to die currently, right? BP is kind of, it's kind of high. Diastolic's not too bad. Mm-hmm.
Other hospitals are managing this crisis, so you can either step up your game or you can step aside.
She want to talk about numbers and all that type of shit when he's trying to save lives out here. Yeah. I understand.
This Samaritan dude has a small left temporal.
I've seen a lot of those conversations.
You could recover. CT can take her in 5.
I'll stabilize the knee for the reduction, acting distally before moving medially to clear the tibia.
Don't pass out. There's always one. There's been one instance where I was about to pass the out, and it was like the weirdest situation, and I feel like at that time I had a very high sense of like empathy with the patient. It was like a 10-day-old male patient, and we were doing his circumcision. That was my first circumcision, and I was like, that wasn't in the ER or anything like that. I just had that as a patient, and I was like, I'm gonna pass out. I've seen brain matter, all kind of shit, but that up. And seeing a child that fell in a tub unconscious with their pupils not reacting at all. It was a really white baby too, so he was turning blue. That too.
Falls or injuries?
Tired?
Was this your first triathlon? Have you seen a doctor yet?
No. This goes under your tongue.
We're gonna check a few labs. Take a deep breath from notice.
Little pinprick now, okay?
Take him for lightweight, huh? No pulse. Crash cart, laying flat. Let's check a rhythm.
Saline pads.
Oh shit.
Quick look paddles.
VTech.
Charging at 200.
Got him.
Back to normal sinus. Need a gurney in here.
Holy smokes.
So what's the plan?
I see you when we can get a bed.
Want a Kepler, Lola?
Order's already in. Nice job.
Do you think he'll wake up?
Maybe. Maybe not.
Y'all did what y'all could.
Goes unpunished.
Healthy 31-year-old VTech arrest 2 weeks after triathlon.
98 BP 110 over 60.
Drug overdose, electrolytes, Brugada syndrome, WPW.
How you doing there, Otis?
Okay. What had?
VTech again?
Charged and clear.
Back in sinus. Otis?
Oh, groaning's good. 5 of nasal O2 CBC, CMP, troponin, and D-dimer.
Look at the monitor. Why didn't you arrest? If you arrested you, we might not get him back.
Yeah, because you do need to wait. But if they're not getting the labs back, yo, Rhabdo will f you up. Rhabdo will f up and have you pissing orange or brown, black almost. You can die from that. He overexerted himself.
Calcini, you could kill him. Wait.
It's my ass, not yours.
This motherfucker.
But there may have been a medical etiology if she fainted. Okay, thanks for nothing. Last interpreter thought she might be from Pakistan.
There are 77 languages in Pakistan.
Oh, shit.
Okay, well, I will buy lunch for whoever figures it out.
I got $50 so she doesn't last through this shift. Come on, put your money where your mouth is.
No, I didn't say anything, okay?
You want to sell a kidney? I could get you 30Ks. That's just between you and me.
She is not dead ass. Come on.
Potassium is 7.7, creatinine 5.6.
Ordering 10 units of regular insulin.
Why insulin glucose?
Shift the potassium intracellularly.
Exactly, but the definitive treatment is...
Hemodialysis.
You ever seen a dialysis catheter insert?
Oh, my chest.
Yeah, we had to shock you. You're gonna be sore for a while. You guys think? You okay?
Why wouldn't I be? Are you okay?
Why wouldn't I be? You seem annoyed with me already, and I just got here.
It's not always about you, Robbie.
When your kidneys don't work, potassium builds up and messes with the electrical. You know, we gave you medicine to lower your potassium, and you'll need dialysis. You might need a week or two. You really need to triathlon.
I won't let this happen again.
Be kind to yourself.
That's what you need. Good people in there.
I think she was waiting for her attending to sign off.
I parked her in the lounge under the guise of a work. Will you just go in there, eyeball, and make sure she's all right?
VFib unresponsive to 3 shocks, 2 rounds of echo.
Huh.
What is that? Robotic CPR.
What? I don't know. I've never seen that.
Get a hold. 1, 2, 3.
Students are dropping like flies.
Take a break. Ice the finger.
Practically set your watch.
Lucas off,
Still VFib.
Lucas on, and then we call it.
Joseph Spencer, 79, fever and cough.
Okay, let's move her to the viewing room and notify the family. Is to take a moment of silence.
Yeah, the dude was finna just dip
For
out.
humanity, and also to remember, or sibling or parent.
That's how it be.
I'm so sorry.
Maybe leave it on vibrate while you're working.
I'm sort of savant.
I just wanted to apologize for any trouble my clumsiness might have caused.
Oh, I can't tell how many times I've hit my head on over it. Why don't you go work with Dr.
I've knocked myself out of those one time too.
Oh, I don't need special treatment.
Good, because I don't give it.
Look, I know I might look too young, but I studied my ass off to get here. Probably harder than the others.
Respect your dedication and your determination, but while you're here, you're my responsibility. Wow! Abbott called for a survey. Lucky they didn't perf.
I'm here to see my daughter.
I'm sorry, is that a patient?
That's her.
I'm talking to her.
Ah.
Am I interrupting?
Come find me when you're ready to present your next case.
How's your first day going?
Great. Yeah, really great.
Aw.
Hey, crashed.
Oh, South 15th. There's no nuchal rigidity, no focal neuro.
I'm curious about that one. So that's the other thing that's going on here, right? Like, even though you got all these moving pieces on, people still have their personal dynamics with each other as well too. And the like the banter and stuff like that, like that's pretty spot on. Like that's how working in an ER is. Like you hear jokes that sound like, bro, is that a joke? Like it can sound like some really up shit.
Do you think you could have ingested something? Pills, vitamins, any prescriptions that may have been left around?
I have a guess.
Locked in the medicine cabinet. The whole house is childproof.
Out.
No. What about pets? No.
Any injuries?
Throbbing.
Yeah, the blood's under pressure. Gotta drain it.
No anesthesia? Or?
Stop before I hit the nail bed.
Yeah, that's gonna fucking not feel too great.
I'm just looking who to see next.
We're supposed to take them in the order they arrive. Do you want me to choose for you?
Pain's gone, thank you.
All right. How about a 20-year-old coffin 8?
I don't need an easy one.
Yeah.
Suit yourself, Huckleberry. Maybe I'll catch a subarachnoid.
Why do you keep calling me that? Huckleberry? Sounds like sarcasm. Yeah, I guess.
I rest my case, Huckleberry.
Come on, man.
I'm so sorry, ma'am. We don't understand you.
Dude, at this point, problem solve. Print out a sheet of paper that has all the languages of Pakistan that you can think of on it, and hold it up in front of her and have her circle the one that she knows. And Google Translate what that language is, and then find out who the I need to find as a translator to get it done to y'all. Come on, what's going on here? What's going on?
I'm Dr. Heather Collins. I'm from here, Oregon.
There you go.
Where are you from?
Zoom in on the shit. Nepal.
Paul.
Victoria Javadi, this is Chiara Alfaro. She's a department social worker, which pretty much makes her an angel. So what rotation is this for you?
I've done OBGYN. Really?
Well, what are you leaning towards?
I'm not really sure yet. I'm 20, and I've earned the right to be here.
Shit.
For a minute, Lean Shamsi from surgery is a friend or relative of yours?
Yeah, she's my mother.
Oh.
Yeah.
Yeah, they're all smart as.
I'm sorry, that was a joke. That was a joke. And I'm sure that comes with a lot of pressure. Age thing. I'm a 42-year-old R2, so I have my own haters, trust me. Sometimes when it gets busy, we'll help the nurses bring back patients.
That does have to be a lot of pressure on you. That family dynamic added to it.
Any chance someone can see me now? I've been here for like 2 hours.
Some of whom are severely ill.
Chest pain. No, it's not plural. It's just chest pain, not chest pains.
Yeah, and if I have more than one, it's chest pains.
It looks here like you got an EKG.
Patience.
And you are next in line for lab tech. Okay, so listen for your name. Hi, I'm Dr. McKay. What's going on? What's her name?
Teresa, she's my mom.
Hey, Teresa, when did the vomiting begin?
Shit, man.
The lady with the gloved foot is Nepali.
Oh, hey.
Otis's BP is crashing. 70 over 50. Still waiting.
Again.
How you doing there, Otis?
Diastolic collapse of the right atrium and right ventricle.
Oh, shit.
Yep.
Too much fluid and pressure around the heart. Chambers can't fill.
They finna go in.
CC's at 1% width.
Chlorhexidine.
Oh, they're on point.
125, 125.
They should be repeating that shit back to each other just to make sure, but whatever.
Pressure down 60 over 40.
Wait, you can't ultrasound in place.
Taking the probe. 18 gauge thin wall. I'm going in right over the center of my probe. Looking for the hyperechoic tip. Dr. Santos, you see that sea of black?
Got it.
3 cc should be enough.
Pulse ox is 99.
Pressure's up 124 over 78.
That was cool.
Yeah. She gotta start trying to battle dude so much. Like, nah. on a team, I mean, yeah, you can say stuff to people, but like, you gotta be kind of. They're getting hit with everything.
David, have you had any vomiting? Anyone else sick at home? From COVID.
Potassium 3.1.
That's it. I have 10 in the bag.
You traveled out of the country recently?
We never go anywhere. She can have to stay here.
I'll slap his ass.
Dennis Whitaker. I'm one of the student doctors here. I'll be seeing you first.
I seen him in something else too.
150 over 90.
Why the black dude gotta have high blood pressure? Oh shit.
Oh, we'll get that for you.
Tell me about this belly pain.
Started about here. Pretty intense. Lasted about an hour. Now it's gone.
You should be able to manage with a low-fat diet, but pancreas, just let us know if you...
Good job.
You want an EKG?
No, yeah, that's a great idea. Thank you.
Yeah, do multiple things. You can't just always go exactly with one. Even though I said good job, yeah, you have to rule out other things. You got their cavity wipes and shit all out there.
I'm going as fast as I can. I'm picking up 2 patients. Oh yeah, I need a fresh set of eyes.
For what?
54-year-old woman brought in with intractable vomiting and birate 2-month son.
Yeah. What's going on with that?
I don't know, maybe she was given something. Some sort of elder abuse. It's just a strange dynamic I can't quite figure out. You're really good at sussing out that sort of thing.
All of our labs are back on Sleepy Boy Tyler. All 100% normal. What do we miss?
And that too. What's going on with you?
Is he waking up?
No, he's still fast asleep.
Results are in and they look great. No electrolyte abnormalities, no diabetes, no,
So what's wrong with him?
Did he have a play date yesterday by chance?
To do that.
David would bring me here. My son has some problems. He needs professional help.
Shit like this be happening.
I found some of his writing. I thought it was school, but it wasn't. His list of girls he wanted.
Giving him a super curveball. Yeah, we gotta figure this one out.
They should all be eliminated.
I didn't see it there.
No, he's not a bad kid. And I didn't want to call the police because I was afraid they'd overreact. He's just a kid.
How old is David?
17.
He just turned 18 last month.
Then he's considered an adult, and he would have to consent to treatment.
He's a good soul.
How you feeling, Crash?
Stop calling her that.
You call me that.
Why not?
She got a nickname for everybody.
I don't like it.
Yeah, respect the boundary.
It's just a joke. It makes you feel any better. I sharded the first time section.
Really?
Of course not.
There's a lot of people that work medical that are like that. Because they're a bunch of assholes, smart asses, and we all think we know everything.
Mom's vomiting is self-induced for the sole purpose of getting him here after she finds his death with his classmates.
Okay. Yeah.
What does she want us to do?
Help him, protect him, save him.
Where is he now?
Talking to McKay.
Shit.
Does anybody? Not even close. You know you can always come talk to me, right?
Aftercare instructions, prescription.
People have thoughts that can disturb them. If you've had any, it's okay to talk about.
Does that have to do with my mom? Yeah, she's gonna be fine. She's probably got a stomach virus, maybe food poisoning. I think she's more worried about you.
She always worries about me.
No, it's almost 8. I gotta go.
Oh, please don't say he goes to school.
5 minutes.
Go get him. Don't hurt yourself trying to run.
Got a college kid, respiratory arrest, coming in hot.
Shit. Like, damn, he doesn't get a break. Like, yeah. You get hit with what you're actually doing. When you're not just in the flow and groove and you see all this shit, you're like, oh shit. Yeah. It can feel like a lot. Pull yourself together, brother. Pull yourself. You got it. Come on. Oh, that's where we end, yo. I really enjoy it. I liked it a lot. I'm excited for the next episode. This is a dope recommendation. I like the yeah, they cover a lot of the bases of what's really gonna be happening. Working with a team, you're gonna have people shadowing you. Maybe your floor is full. You have the patient care aspect. Then you have the what do we call it? We had the quality assurance program where patients tell you how well you're doing and the stuff that's on the internet and percentages and shit like that. The stuff that your higher ups are looking at. But we're just here to save lives. If they're alive, they should be happy, you know. And then you get into some of the politicking that goes on with it. Like, yeah, if y'all would open up some more of these rooms and different stuff like that, yeah, we could get these patients out. Half the people that we have here are patients that are waiting to be transferred to other parts of the hospital, ICU, shit like that. But y'all ain't got beds, or y'all don't want to open up the floor, so y'all use the ER to hold them because it's cheaper, you know. And that speaks loudly. I like, you know, even the way we end it whenever he's coming out, right? It's like when you're in your flow, oh, it's cool, it's hunky dory. But once you get a chance to step back and then come back in and see like the daunting task that you have, it's like, oh shit, oh, like I'm responsible for all this. This is my team. These are my people. I need to do all this shit. I got some shit going on too, and I need to be on my game all the time. We see when he come in, initially he's with his headphones. It's like he's almost hyping himself up for it. But now he's coming in without the headphones, and it's just, you see everybody and all the shit going on. It's overwhelmed him. I like that a lot of the cases were things that you had to kind of guess and get to be intrigued about, and what specifically could have been going on with that. Like yeah, it made sense for a kid to be in there and stoned as and we don't know what's going on with him until somebody just swabs his mouth. You would have people coming in, not exactly like that, probably not, but some cases you never know. Like I'm not really here for me. I'm here trying to get my kid seen, but I didn't want to take him straight to the cops because I don't want them to think he's insane, but he's actually over 18. So what can y'all do to help him? She just wants us to help save his life, basically. And now I need to give a warm handoff to somebody else on my team to help with this kid. And this is almost out of our realm, but it's not. We're doctors, but we also have to deal with other aspects and utilize all of our other resources to take care of people. The girl whose mother works there, there's a whole story you can get into. I think it's very intentional, the ethnicity that they picked for those characters as well too. The person who's coming in nobody knows the language that she's speaking, and that creates a barrier that we have to figure out to get past that. Everybody has their own shit that they're going through outside of being in the ER. Then you have the young talker who's making people feel bad, but like that's a lot of people in our line of work are like that because we all are smart, asshole-ish people for the most extent. Then there's some people who are super nice, but it's so easy to be or condescending because you're somebody who has to study and hit these like checkpoints. It draws a certain type of person to it usually, even if it's like not to be straight just an asshole, but like people want to joke around and play. The jokes we come up with are the shit we see looks fun. We're desensitized to a lot of things. I think this was great. This was a great episode 1. I'm ready to watch episode 2. So let me just end this recording and then we'll hop right back on for episode 2. I appreciate y'all. I love y'all, and I'll see y'all in a second.